Wellness by Design is in the house this morning, and we're talking about hair regrowth and skin tightening through platelet-rich plasma. We're joined by Dr. Connie Casebolt-Carver and Ann Pert to tell us a little bit more about it. Good to see you guys.
Good morning.
Yes, good morning.
Yeah, so let's talk about PRP. What is that, and how do you use that to kind of help regrow hair?
So PRP falls under the umbrella of one of our regenerative therapies. So regeneration means that you can sort of reverse aging and roll back the years. So specifically today we're talking about what it can do for hair. Thinning hair is a problem, causes a huge lack of self-esteem and a lot of emotional angst, men and women. And it can be due to a variety of factors. And actually, we're pretty careful about checking for those. So we're going to make sure that your minerals and your hormones, but sometimes even when we optimize all of those, there should still be some thinning hair. And of course, as we get older, we can also just start to show signs of aging on our face. So it turns out that Ann Pert was our first patient that we decided to do the hair restoration on. So why don't you tell about what you were experiencing and how it went?
Okay, so I like to do a lot of the services that we offer.
Well, that way you can really promote them. You're like,
So one of the problems that I had being a cancer survivor was chemotherapy was causing hair loss, and had a thyroid disorder that was causing hair loss, getting older, hormone imbalance, so
stress
from
all of the big
all of it. So with curly hair, I could hide it mostly, but I still had a self-esteem issue. And even the hair that I did have, the hair follicles started getting smaller and the hair coming out was thinner and would break off. So it was really frustrating, and I couldn't grow my hair out. So we did the hair restoration, the PRP, and the response on my head was phenomenal.
Really?
So it took about a week before. It took about a week before I had a bunch of new prickles and new hair. But that's just at 4 weeks.
Wow,
that's incredible.
That's the first picture. There's another picture on there too, of the top of my head, and it's kind of embarrassing to show how thin my hair was, but just in 4 weeks'
No, but that's so good, so you can see, because that's so, I mean, that's a lot what a lot of people are dealing with.
It's a huge difference. The hair that I have is getting thicker, and now there's new hair follicles with new hair growing, so it's getting really thick on top.
I've seen when you do like the PRP on your face for like, is that, you do that on your head, like the little thick?
So the technique is slightly different. When we do it for hair, we're using little tiny needles to do periodic little injections. With the face, we're using more of a, I guess it's called a micro needling technique.
It is.
But we're still using PRP. And again, just to reiterate, the PRP is something that we draw from the person, we draw blood, spin it down, we extract off the platelet-rich portion of that, and that's what we use to re-inject back into the patient.
So you're using your own
material,
all
natural,
regrow.
So smart.
How many treatments of that would a person have to have? I mean, I know every case is different.
So typically we're going to do the PRP on I think both actually, every couple of months is what our protocol
about every
is.
8 weeks for a year. You may need a touch-up once a year, but that's not a necessity.
But look at how fast the results happen, though.
And I think we have a picture coming up of a face.
That was just on there.
Oh, that was on there.
We just showed it. But so how long was that before and after?
I think about 2 months.
About 2 months.
So again, it's rolling back the clock, and we're already other patients besides Ann are coming back and going, wow, what a difference.
People may see vampire facial. It's only because of that using your own
blood.
Yes.
That's why you don't look like a vampire. It's just the technique.
But you can tell. I mean, it's like a subtle, but you know what I mean. It's not like, oh, you went and had a lot of work done. She just looks refreshed. She just looks.
That's actually the best term, refreshed. It's kind of like you roll the clock back a few years, looking a little more relaxed, and it doesn't have that artificial, like really pulled back tight, like you're in a wind tunnel.
Like, oh, you had good work done.
You don't want you just want people to say, oh, you look so happy or so refreshed or whatever. So. Yeah, we're really excited to be able to offer that, and so we don't do seminars for this because people can just see before and after pictures. But if anybody wants to find out more, we are offering personalized one-on-one consultations for free. So no obligation. Just need to call in and say I'm interested in PRP, And actually our nurse practitioner who's doing that procedure, she's the one that sits down with people, explains it.
Yeah.
She'll do an evaluation of their face or their hair to just see what they need.
If you're a good candidate,
You should all dial in and say, I'm down with PRP.
Yeah, that's what I'm saying. Down with PRP. Numbers right there on your screen, Wellness by Design. Give them a call, go on their website, and ask some more questions and see if this would be a good fit for you. Thank you so much, ladies.
Thanks, guys.
Thank you.
Good. All right, we're going to take a quick break and we'll be right back with a lot more. Your Carolina.